All right, so here we have a 40-year-old patient, right-handed, and he's a painter. He's having right shoulder issues. So we are going to work on the unaffected side first. So we are going to do shoulder extension or shoulder flexion and then shoulder external rotation. So can I have you lay down, sir? You can lay down back facing the ceiling, or the head facing the ceiling. So first we are going to do shoulder flexion. All right, sir. So this is your left arm. So we're going to go left arm before we do right because it is the unaffected side. All right. Can I have you move that arm as far as you can towards your head? Perfect. That's perfect. Now bring it back down. One more time. Perfect. So we did passive and active range of motion. For this, the goniometer, we are going to look at his greater tubercle and his lateral epicondyle. So we are going to move him into shoulder flexion one more time. Perfect. So I am going to put my stationary arm down his midline of his body at his greater tubercle, and we are going to look right at his lateral epicondyle. And he has 175 degrees of shoulder flexion. All right, we're going to do his other side, now his affected side. So we're going to move this arm just like this. We're going to put the stationary arm down at his greater tubercle and put that to the lateral epicondyle. And this is going to be 170 degrees. Next up, we are going to do external rotation. Can I have you scooch? You should be good on this side. I'm going to put this towel underneath. Can I have you scooch your chest just a little bit this way, sir? Thank you. I'm going to put this towel underneath. We are going to flex both his shoulder and elbow at 90 degrees. And then I'm going to check his rotation actively and passively. And for this, all right, I'll put it right here. I'm going to have my stationary arm. This goes from the olecranon process to a styloid process. And I'm going to have my stationary arm facing perpendicular to the ground with my rotating arm to that styloid process. And here he has 105 degrees of rotation. Sorry, he has 75 degrees of rotation. All right, we can put this one back down. And then can I do scooch the same side so I can do your right? Perfect. Just like last time, we're going to flex the shoulder and the elbow 90 degrees. We're going to check until we feel his end range. And just like last time, stationary arm goes perpendicular to the floor at the olecranon process. And the movement arm is going to go to that styloid process. And he has 85 degrees on that side. So he has 85 on his right, and he had 78 on his left. All right, can I have you sit up for me, sir? Perfect, and you can hang your legs out this side of the table. Now we're going to do a manual muscle test of shoulder flexion. So can I have you just raise your arm as high as you can go without hitting the ceiling fan? Perfect, we are good. Back down. And now we're going to raise your arm to 90 degrees. Sit back straight. All right, for this, I'm going to push down on your wrist right here, and I'm going to stabilize the superior border of his scapula. And when we do this, the anterior deltoid is the agonist and the posterior deltoid is the antagonist. All right, we are going to do 1, 2, and 3. That's a 5 grade for manual muscle test. And now on his right side, we're going to do the same. We're going to check. We have full rotation, and then back down. And then again, the lateral border of the scapula. Push down on that wrist. 1, 2, 3. Alrighty. For that, he has also a 5. Next up, we are going to do external rotation for his unaffected side first, which is his left side. Can I have you lay back down, face towards the bench, please? Can I have you flip over real quick? Thank you. And I'm just going to scoot you a little bit towards the end of this table. I'm going to throw this underneath one more time. So for this movement, the agonist is going to be the infraspinatus, and the antagonist is going to be the subscapularis. We're going to check this rotation. All right. So for this one, I am going to push down on your wrist towards the ground. I want you to fight that resistance. And I'm going to stabilize that infraspinatus to feel that flexion. All right, 1, 2, and 3. Perfect. I'm going to put that as a 5. We're going to his right side now. So his affected side. I'm going to put this under again. We're going to have 90 degrees at the shoulder and 90 degrees at the elbow. I'm going to feel that infraspinatus. All right, just like last time, I'm going to push down on that wrist, and then I want you to fight back. We have 1, 2, and 3. Perfect. And he has a 5 on that side. Can you flip over for me, sir? Now we're going to do the muscle lengthening test. I'm going to do his unaffected side first, his left side. And for this, I'm going to move his arm up, and then you can break at the elbow for me. I'm going to hold up my elbow right here. I'm going to hold his elbow and put him into a little bit of external rotation, feeling that lat. So we start in, and we feel that muscle lengthen. Perfect. And now for the other side, just like last time, you can break at the elbow for me. Put him into a little bit of external rotation, feel for that lat, and then we are going to feel that muscle lengthening. Perfect. All right, we can sit up for me, sir. We're going to move you to about right here. Now we're going to work on our transfer. We have our belt on. And for this, can I have you put your feet on the floor for me, flat on the floor? For this, we want feet flat on the floor. We want the PT's knees on the outside of his knees. With this, we're going to grab the belt. Already on 3, we are going to move you to the couch. We're going to rest his weight on our body, and on 1, 2, and 3. We are going to move him to the couch. Perfect.